Good morning, everyone, and thank you for joining our webinar on sharing notes across teams to create rich, qualitative and quantitative records. My name is Chris Dobinson. I'm one of the iplanit consultants for Aspherical, and my role today is to assist my colleague Terry Langton, the iplanit project director, who will be presenting today's webinar. So without further ado, I'll hand over to my colleague Terry Langton.
Thanks very much, Chris. Good morning, everyone. Thanks for joining us this morning. So what is iplanit? So you might not have seen iplanit before, so I'll just quickly go through what iplanit is, how it works, the idea behind it. Well, it's a flexible and modular cloud-based system. That's the best way to describe a cloud-based system. It's on the internet, and it's primarily designed to help plan and record all types of support needs. So people have learning disability, physical disability, mental health, aged care, and so on. It enables thousands, currently enabling thousands of support workers around the world and service leaders to deliver on the promise to the people they support, which is very generally, but quite meaningfully, it's to improve people's lives. You know, that's why we do this job. My background is support work and consultancy within person-centered planning, and all of that is pushing in the direction of improving people's lives. And iplanit was designed on that premise to keep them safe from unnecessary risk and offer transparency to loved ones, so to include family and circles of support in their planning as well. So people supported in their loved ones, they can access their plans on iplanit, so a person supported can invite people, family, to see their plans. I mean, it's limited as to what they can see. It's all very appropriate. The support provider has control over that, you know, for safety and so on. But it does offer that level of transparency. It's very difficult to get on paper. So the positioning of iplanit within your organization is really important to understand where it fits. We've been operating now since about 2010, 2011, and the footprint of iplanit has really grown. But one of the things we've been very careful to do is not to become a back office or purely a back office system for providers. So we don't do financials and payroll, human resources, or staff roster. And although iplanit's starting to touch on them, it's never going to be primarily those things because there are other systems to do that. iplanit fits into, if you can see from the graph here, it just touches into those things. So there can be financial module. There are financial modules within iplanit that can help with funding, the human resource. We do have training records for staff, and then there are planners for people support, which can link into the staff roster and rota systems. So it's starting to touch those things, but our primary goal is to help improve people's lives through measuring impact of the outcomes and help organise staff around the person. And as that footprint has expanded, that started to include things like risk management, calendars for persons supported, needs assessments, support tasks such as personal care or meal preparation and so on. So iplanit kind of positions itself where it can link in with those back office systems that you have, but that's not its purpose. It can help support them and connect to them, but its main purpose is around the person supported and help the organisation get reports from all of that support work that's being delivered. That's the iplanit position. So the iplanit, in summary, the reports I've just mentioned, they can give live and accurate evidence that providers can use to show to their funders. So it's constantly gathering information from the point of support regarding key performance indicators and so on, key performance indicator monitoring. So you can get an organizational picture, or you can get a drill down and look at the individual picture for the person from a management point of view. That's a bit of a theme for today's demonstration as well, because we're talking about notes and reports. We're kind of balancing those two things. When we roll out iplanit with our customers, it's designed to be configured to the way your organization works, so we can change the language to your language, because what iplanit doesn't do is it impose its values on your organization. Your organization has its own value set, has its own language as to how it talks about the people you support and how it talks about the goals and so on. We can configure all the language to match that, as well as the plans. A large part of the rollout for new customers is to make sure the plans on iplanit are configured to how you work. So one of my roles within iplanit is to train new staff to use iplanit, whether that's managers or direct support staff or nursing staff. And the litmus test is that the staff recognize the plan that's on iplanit. It's just a digitalized plan, which becomes, in the background, is very, very powerful. The ultimate thing is we've configured all the planning to match how you work, so it's quite an easy processor to use in iplanit. It's won 7 international awards so far. We're in Australia, New Zealand, Ireland, across the UK. That's won 7 international awards for us there. And because one of the main points about iplanit, which hopefully will come across today, is the architecture of the system, the IT system, the programming and coding is designed around the person. So what that does, not many, I don't think any systems operate like that. Most systems are designed around the organization, but the benefit of designing it around the person is you can scale that while it still offers very powerful organizational benefits. So it works both for very small providers and also multi-region providers as well. So we have some very, very large customers. We also have some very small customers as well. And the process, the system works for both needs because the whole system is designed around the person. We also talk about that configuring side of things. We also configure iplanit to be in touch with your the KPIs and the local validation pressures that might be on your organization. So, for example, supporting people and all of the frameworks you have to work to there, or CQC, or NDS, and so on. So iplanit is configured to work with whatever external key performance indicator pressures that are on you, but also internally you can create your own key performance indicators. So usually most providers have a mission statement or a framework of values that they have internally. Well, you can actually turn them into key performance indicators within the system to see how your own organization is performing against its own values. So it becomes very, very powerful and very, very useful on an organizational level, which filters down or filters up and down between individual level and organizational level. So if we had a kind of a map of iplanit, that's what it would look like. In the center, we have the core iplanit, which is what you get with every rollout of iplanit. So that's reports, notes. Notes is one thing we're going to look at today. Plans, which are configured to your plans. We also have an array of plans that we've got that we've worked with other providers. The majority of customers we work with have their own plans, obviously, and we configure the system to match that. You can have document management and workflows, so things like, if there are always things that are going to be on paper, we recognize that, and to make sure it's all in one place, you can very easily scan these or take pictures of these and put them into somebody's file. So if it's something like a tenancy agreement or a note from a doctor or a file like that, it's very easy just to upload it into iplanit, and there's storage for that. There's outcome tracking and alert panel outcome tracking we're going to look at as well in line with the notes. And just directly opposite outcome on the other side is the KPIs. All of these things we're going to pull together as part of today's demonstration. There's a dashboard which really helps staff organize themselves. So this is internally, there's the core iplanit. And then on the outside is the modules that you can add on to this. So we, when we work with new customers, we give them an overview of all of these add-on modules that they can have. And then they choose what fits them or what solves their problems. Very rarely somebody gets all of them, the add-on modules, because if you think of yourself going on a journey with iplanit, you start with your core, and then you might say, well, actually, needs assessment is something very important to us, and we'll integrate that straight away. And then as time goes on and staff become more involved with iplanit, more skilled with iplanit, they start to add more modules onto that, so you have a kind of a pathway, a roadmap to get iplanit to start solving problems and creating efficiencies within your organization. So there's a calendar that the person supported can access about their time. Surveys, like a customer satisfaction survey, or there's a survey facility there which can be manipulated to do lots of different things. You can have a record of staff qualifications. We touched on the finance, funding and budgets. Support tasks, which we'll have a quick look at today, and then there's advanced clinical care planning, and their new module, event incident and management, so a very detailed event incident management system which helps you record and track incidents, you know, and all the different actions that need to happen with an incident, and you know, keep a good record of that. So that's what the system looks like on the map. We'll cover a bit of that today, but other webinars go into other modules and other core aspects of iPlanit in much more detail. So today we're focusing on notes and reports. So going from that, notes and reports, I think what I'm trying to show you today with today's demonstration is the balance between strategical need of the senior managers and that the higher end broader reports that managers need to see, but also how having note-taking capabilities is really effective for teams to work around the person and really come together around the person and get much more efficient outputs of support, much more relevant and direct, and the person really feels the benefit of being listened to. So from top level, any kind of the leadership decisions that can be made based on performance. So one of the challenges of creating evidence sets for inspectors is a lot of the support is anecdotal. So the storytelling of how somebody's life has improved on an individual basis, and I think that's very, very important that people's stories are told, but that can be quite difficult to record or to see in any organized format. So this is what the notes is about, really, for iPlanit, sharing that information but keeping it there for storage so it can be shown to the relevant people. So on a manager level, they can see KPI reports, they can see how outcome statistics, so how many outcomes are being achieved, what those outcomes are about, how many outcomes are not being achieved and why. And then they can kind of drill down into that and look at some of that, what we'd probably describe as anecdotal or qualitative, the quality aspect of that support being delivered by drilling down into notes, the actual outcomes themselves. And you know, one of the big important things is seeing whether people are being spoken to about respectfully and that the culture of the organisation, how records are being kept. On the level of support delivery for support workers and management at support delivery level or care delivery level, just having the ability and efficiency to have multiple platforms to record the relevant notes in the right place and to be able to access them quickly rather than having to go to paper communication books or to charts, or in terms of if there's a local manager who runs a number of different services, then to have to travel to that service to read through the notes on physical paper and the different quality of that. This note-taking capability takes all that away, and the manager can read all of these notes from their desk, and then their visits are much more meaningful, so that visits are more proactive rather than getting there and having to read lots and lots of paper material just to get up to date. So that on the management at a local level is really, really important. But then for the staff, the support staff, the handover, I mean, a lot of the recent Care Quality Commission information has shown us that one of the difficulties is that people supported don't feel that they're being listened to, or they have changing staff all the time. And that's just a challenge in the industry, isn't it? That sometimes we have to use relief staff, and sometimes staff change a lot, and the communication between the staff, because it's quite isolated work sometimes. And it's very difficult there's not always time to get that effective handover between two staff members. And the notes really supports that, so a person can log on their phone if that's secure within your policies. They can log on their phone, get up to date on the service very, very quickly, look at all the notes and the shift logs very, very quickly, and just be up to date and ready to start work as soon as they get there. And that just improves support. So looking at the service user satisfaction and provider performance, the person supports, if everybody's informed and everybody knows what happened last shift and everybody's working around the outcomes, the people supported feel the benefit of that because they feel like their support is a lot more consistent, and people seem to know what's going on, and the person supported isn't having to repeat themselves all the time about how they want this to be done or how that's supposed to be done or where they're going to go today or how their care is administered or how they take their medication and so on. So there's good support planning, but not everybody has time to read the support plan regularly, whereas the support notes can help really be a pillar to that. If there's good communication on the team, you should be able to access that communication, which kind of brings it all together. So just very briefly before we head over to the iplanit system, kind of done this diagram here just to give you an idea. So there are 3 points here. Having informed leadership is helps bring through strategic reports. We can have informed leadership. Whereas on the bottom right, team communication, having a convenient information sharing, some places for staff to share knowledge. Your staff are the biggest resource within the organisation, and if we make sure that they've got places to put their information, to put their learning and share that learning with the team, and all of the team are doing this, whether it's the nursing staff, whether it's direct support workers, whether it's outreach support, it doesn't really matter. It's about sharing knowledge. If there are places to do that, then moving over to the left, that creates an improved support and care. So that constant learning improves quality and care. So if one person has a good experience on support because they did something a bit differently, or they administered medication a bit differently and it went better for the person, they've got somewhere to share that and for the whole team to be able to see that instantaneously. If we have those two pillars there, then that starts to bring informed leadership. And that's the balance, really, balancing statistics with support staff knowledge. It ensures a complete picture of the person's service and the organisation as well, because it's all interconnected, which I'll show you. So just before we move on to the demonstration, good support should not be a tick box activity. We know this. A lot of systems are out there just kind of saying, yes, support was delivered, and it's kind of just a statistic. Whereas if we start to create space for the staff to share knowledge, like we've got here, which I'll show you a bit later, it shouldn't be recorded in that way. It shouldn't be recorded as a tick box. If we give staff places to record their knowledge, that's what they will do. Because if they've had a great experience or not a great experience, there could be learning and reasons for that. Give them spaces to put that information. The team starts to work more cohesively. So we had a look at that map of iplanit, but just as a reiteration, these are all the places in iplanit we can make notes, and I'm going to show you that on a demonstration now. So key performance indicators, plans, outcomes, reports, the needs assessments, events and incident management. I'm going to be able to get through all of these today, but just to give you a flavour of it. So there is lots of opportunity in iplanit for staff, not to just be saying yes, something was done or not done, but say this is what we learned from that.